Chief executives at hospitals, mental health trusts and community services in England have been ordered to review staffing levels and draw up plans to close some services and merge others together. That, according to a story in today's Sunday Times. Dr. John Puntis is co-chair of the Keep Our NHS public campaign. You're also a doctor in neonatal care and general paediatrics. John, I know you had an opportunity to listen to some of our callers over the last hour. In your own practice, what have you seen in terms of parents trying to get help for their children, and why can't they?
Hello, Sangita. Yes, I listened to the gentleman speaking about his daughter and, a very distressing situation. I mean, I retired 5 years ago, but I worked in children's services for 40 years in a specialist tertiary centre. And it was clear that it was becoming more and more difficult to access CAM services for children. So I would see a lot of children who would benefit from a CAMS assessment, and a lot depended on where they lived in terms of whether it was accessible. There were some areas where there were just no services and other areas where there were good services. But even in hospital, it became extremely difficult to get a psychiatric assessment of a child who obviously had very major problems, unless they were frankly suicidal. And that was, I found, quite astonishing, because in a sense, they became the only specialty that were allowed to say, thank you for your referral, but we're not going to come and see the child. And a lot of this was due to increased demand and inadequate staffing. And if I can elaborate on that, I mean, I think what this discussion just now has shown, and you've alluded to, is this increase in demand, which is very real. But of course, increase in demand happens in many other areas as well. So, for example, a 5 million increase in the population since 2010, an increasing proportion of the population that's elderly and living with chronic illness. And this means that the NHS has to spend more. It cannot rely on budgets which were designed before this increase in demand came about. So when the government says, as it always does, we're giving record funding to the NHS, it sounds wonderful, but actually if you look at that funding in relation to demand, there's actually an overall reduction in funding. And this is one of the reasons why services are in crisis. And we have about 120,000 vacant, 8,500 doctor vacancies, 40,000 nurses vacancies. We've got this 7.8 million waiting list, 2.8 million people who are not in the labour market because they're sick. And what's the government's approach to this problem? It's to say, why don't we cut more staff? Why don't we starve the NHS of even more funding? And we need to look at Europe, I think. We spend 18% less per capita on health than comparable European countries. If we spent the same as France, we would have been spending 40 billion a year more over the last decade. If you look at Germany, it would have been 73 billion more. So despite these claims of record funding, in terms of what other countries are spending, we're nowhere near that. And that's why we're seeing the crisis in many different services, including the one that you focused on just now in children's mental health.
Dr. John Puntis, co-chair of the Keep Our NHS public campaign, a doctor in neonatal care and general paediatrics, setting out, I think, very visibly for us the backdrop to the crisis in children's mental health services. Thank you very much indeed for joining us this afternoon.